The Chinese government, they released the 2023 National Healthcare Development Statistics. And I think it's important for several reasons. First, it highlights the increase in the cross-regional medical treatment, and it has reported to reach about 240 million cases in 2023. And I think it's notable because it indicates progress in providing healthcare services to a very large population of over 1.3 billion people. And all this while ensuring that the medical expenses are covered. And in the future, I think it's going to be a very large sum, and I'll explain my thinking later. But in addition to this report seems to indicate that the medical assistance system has continued to strengthen, with the national medical expenditure reaching more than $10 billion. But it reports that it has benefited more than 80 million people. And in these statistics, we see that in 2023, the Chinese government conducted the 8th and the 9th round of the National Centralized Procurement of Drugs. And this involved 80 types of drugs with an average price reduction of 57%. And the number of Western and Chinese traditional medicine included in this list has increased to more than 3,000, with more cancer treatment and drugs for rare diseases being added. And I think that the Chinese government might continue to negotiate to try to reduce the prices of these drugs for their patients. Then, in comparison to the data from the past 2 years, the number of the general outpatient visits, outpatient treatments for chronic diseases, and cross-regional hospital medical treatments, as well as the associated medical expenses, all of this have increased significantly. And we noted that by the end of 2023, the basic medical insurance covered more than 1.3 billion people. And further to this, the direct settlement of the inpatient expenses across provinces has been extended to cover all provinces. And this coverage of all provinces is actually a very big achievement. But let's talk about the future. So in the future, right, I think we could expect to see further advancement in the medical technology and digitization. And I believe that this will lead to improved efficiency of accessibility of healthcare services. Then we should also consider how this telemedicine will evolve in China and how telemedicine will be adapted by the people in China. Then we need to talk about the development of artificial intelligence for medical diagnostics. Then we need to talk about, very importantly, the adoption of digital health records, which in itself is a very serious topic because this kind of administrative work is adding burden to the medical industries all around the world, globally, in every country. Then, besides all this, we could also think along the assumption of continued expansion of medical insurance coverage to include more services and treatment, with an emphasis on reducing out-of-pocket expenses for patients. And we can also expect to see increasing focus on preventive healthcare and personalized medicine. It will be an area of evolution, along with further measures to address the disparity in healthcare access, especially for people who are living in the rural areas and people who are in the... I also think maybe the healthcare system may continue to prioritize cost-saving measures through even more systematic centralized procurement approach and even more negotiation to reduce the patient expenses. But I think there definitely will be challenges as with all types of policies. And in this, the increase in the cross-regional medical treatment and the expansion of the medical insurance coverage in China may lead to several challenges and issues. Why? Let's talk about the budget. The budget is going to be very big. Because of the budget is big, definitely there will be a strain on the healthcare resources. And it's not just about the hospital asset. We are talking about increased number of medical treatment, and this will strain the healthcare resources like hospitals, medical professionals, and we have to consider the wear and tear on existing medical equipment. Because of the large budget, we need to talk about the financial sustainability, because the expansion of the medical insurance coverage and reimbursement scope may pose challenges to the financial sustainability of the healthcare system, especially if the cost exceeds the available funds. Then on top of that, we need to discuss about the quality of care, because with the significant increase in outpatient visits and treatment, we need to maintain the quality of care and ensure that there's timely access to all these healthcare services. And this will be a very big challenge. Then on top of all this, we need to talk about the drug supply and pricing. because the expanded drug list and the centralized procurement may lead to challenges in ensuring a consistent and adequate supply of medication, because this has always been the potential challenges of a centralized procurement system that is related to drug pricing and availability.